we saw that the Alzheimer Association released this recommendation to use the blood biomarkers. People from the field of the blood biomarkers is still saying, we can use the blood biomarkers on clinical, but there are still people discussing this thing about like, we have difference between the platforms. Dr. Mark Fares, like he showed this morning, I study a head-to-head study with different platforms measuring plasma p-tau 181, 231, and only one of the platforms measured the 217 because it's still restricted. And there are differences, like on the assays, like depending on the platform, you have different like accuracy. And I think that one other thing that people say, like, okay, like let's use blood biomarkers, but it's still missing more studies talking about diversity, like measure these biomarkers in different populations, because you can have different results depends on their population. So we need a bigger result, like all the world, like different continents, to evaluate and compare these plasma biomarkers. Before that, I don't think we can like say, it's ready to use on clinical, because we still have the problems of the cutoffs. We have like some populations, like we have the difference between cognitive unimpaired and cognitive impaired individuals, but we still have this thing like in a population, the levels like goes between 0 and 100, and in the other go between 0 and 500. We still have significant difference between the groups. The levels are different. So we need to evaluate more, like measuring more different populations until we reach like say, okay, it's ready to go to clinical. I think we are on the way. There are people like defending and everything, but it's a lot of discussion on this. Like, let's go measure different populations. Let's compare these biomarkers. Let's see if it's consistent, the results before, like, because if you are a physician, like you ask to measure a biomarker and you have a result, sometimes that you don't even know what to do with these results. So still have a little long way to go, but I think we are on it. People are discussing this. It's very interesting. We have even more results than we have on APD related with plasma biomarkers. I think a hot topic now is neuroinflammation biomarkers too. People are looking more on this, especially because it can help you understand more about the disease.